Dewormer for cancers in our dogs and cats. Do they work? Should you be trying them? What about dose? Get all the answers in this video. Hello, welcome back to my channel. If you're new, welcome. Click there to subscribe, hit the bell to sign up for notifications. Then when you click the link directly in the box below, I can send you a copy of my free book. Your dog developed cancer, should you be considering a dewormer? If little Tula here, and I hope it never happens, if she were to develop cancer, I definitely would be considering a dewormer to help treat her. There's a huge interest right now in repurposing old drugs or re-looking at them, drugs that we know have been safely used in people and our animals, and looking at using them in different diseases. And so what they're finding is that there can be really big positive benefits by using some of these dewormers for many of the common cancers. There's three in particular I want to highlight. The first one is called Naclosamide. It's used to treat tapeworms in people. It's a dewormer. It's been used in people since 1953. So it's been used by millions of people worldwide to treat an array of different parasites, but in particular tapeworms. Scientists have now found it's got clear anti-cancer properties in terms of preventing and or treating some of the cancers. There's studies going on right now with colon cancer, with prostate cancer, using this old tapeworm, Naclosamide. Number two, this pasty white stuff sold under the brand name fenbendazole. It's Panicure. I've talked about Panicure a number of different times. We used it a ton in practice. A really old veterinary dewormer used in dogs, cats, horses, etc. Really safe and surprisingly really effective. What the studies have found, they've looked at using fenbendazole for cancer, and they found that it specifically targets the cell walls, a part of the cell wall called a microtubule, and many of the cancer cells in particular, they're just really sensitive to this Panicure, which is kind of what you want, right? You want this super benign drug, really safe, potentially kill those cancer cells. There's two suggested regimens. One, you're looking at a dose of 50 milligrams per kilo. So little Tula, she's about 10 kilos, she's 22 pounds. And so that would be 50 times 10, that's about 500 milligrams. Each mil of the liquid Panicure is 100 mils, so that would be 5 mils. And that's given once a day for 3 days on, 4 days off. You're gonna do that over a period of a minimum of 30 days, assess whether it's helping or not. The other suggestion and the other regimen that some people are using is they're giving it once a day, but they're dosing at a much lower dose of 10 milligrams per kilo once daily, right? Tula's 10 kilos, that's 100 milligrams, it would be 1 cc you should be getting once a day. And they're giving that for a full 30 days first, assessing whether it's being beneficial or not. One thing I need to add in with Panicure, it's incredibly safe. I use it in hundreds and hundreds of animals in veterinary practice. No side effects, so really safe, right? So you've got a dog, definitely, this would be like the first anti-parasitic I'd be reaching for. But if little Tula did get cancer, no question, I would have Panicure, fenbendazole as part of the regimen. Last but not least, this well studied animal dewormer, Ivermectin. Ivermectin, it's an extremely well used anti-parasitic drug. Virtually every animal you can think of, we've used Ivermectin on, and it's really effective. Little Tula, say she were to have lice, which I saw a lot in veterinary practice, what do we typically use? This guy, injectable Ivermectin. There's now a whole bunch of research looking at Ivermectin as another sort of repurposed animal drug for cancer. For most of the common cancers that we can get, lung cancer, breast cancer, colon cancer. Specifically, Ivermectin is being studied for those. And what the scientists are finding, there's multiple different ways that Ivermectin can affect some of these cancer cells. There aren't clear established guidelines yet as to an exact dose. When we're using Ivermectin in our animals, say for instance a dog that's got sarcoptic mange, we're looking at a dose of about 200 micrograms per kilo. That equates to an Ivermectin dose of 0.1 cc of the injectable Ivermectin per 5 kilos or 10 pounds. Right? So little Tula, she weighs about 22 pounds, 10 kilos. She'd be getting 0.2 of the cc, that amount. I do a regimen, giving it once a day for 30 days, then assess whether it was being beneficial or not. You do have to be more cautious using Ivermectin in certain breeds. Certain breeds lack a gene called MDR1. This includes some of the herding breeds, Shelties, sheepdogs, whippets, etc. So if you were considering using ivermectin, first you're talking to your veterinarian. You guys are weighing the risks versus the benefits. Secondarily, you've got one of those breeds, go ahead and test for that gene, ensure that there isn't a deficiency there. But in general, when you're giving it relatively low doses, which 200 micrograms per kilo is, you're probably not going to have any serious secondary side effect. You know, I'm thinking back to my last dog, Lewis, who had this serious untreatable form of a carcinoma, soft tissue mouth cancer. If I was aware of ivermectin at the time, I probably would have tried it on Lewis. I mean, it was kind of at the point where there really wasn't any good alternative option to try. And yeah, I would have been willing to give him, an injection once a day just to see if that would have helped or not. Point of all this, yes, these are real legitimate treatments for animals with cancer. If your dog or cat's been diagnosed with cancer, I encourage you to discuss this with your vet. Thanks for watching. It's Dr. Jones.